is Aubrie Copenhaver. I'm going to be your student nurse today. Can I get your name, your date of birth, and any known allergies?
Savannah Cupid, 12/21/1998, known allergies.
Hello, Savannah. I'm going to be performing a head and toe assessment, if that's okay with you. I would like to start out by asking you to tell me the date, your location, and the time.
It is November 12th, 2020. It's about 11 p.m. and I'm in Stevenville.
The patient is alert and she is patient's alert and responsive to my questions. Times 4. She is maintaining eye contact. She is in a compliant and pleasant mood. She's sitting in an upright, relaxed position. She's dressed for the situation and weather. She has no ambulatory devices to help her assist her with any actions, and she demonstrates being able to hear and speak efficiently by responding to my questions and directions efficiently. I'm going to go ahead. We already went ahead and took her vital signs. Her vital signs, her heart rate was around 80 beats per minute. Her temperature was like 97.8. Her blood pressure was 111/72. And do you have any pain today, ma'am? The patient experiences no pain, and her respiratory rate was a rate of 16. I'm going to go ahead and start off with an integumentary evaluation, if that's okay. So I'm starting off with the face. There's an even distribution of hair across the face for facial hair. Her facial features are intact and midline to her face and bilaterally symmetrical. I'm going to go ahead and look at her arms now. Her arms are tanned with a light pink undertone. Her hair is evenly distributed from her elbows down to her wrists. Her skin is smooth and dry to the touch. She has elastic integrity on her skin. There's no presence of edema. There's a macule. There's 2 macules on her right forearm, right below her elbow, and they're less than a ½ millimeter actually in size. I'm going to go ahead and look at your fingernails, if that's okay. Her fingernails are light pink. They're round and cleaned and groomed. They're adhered to the nail beds, and there's no thickening, and there's no, they're not rough, they're smooth, there's no ridges. Same with her toes, there's toenail polish on them, but you can still see they're clipped and round on the edges, very hygienically correct. There's no thickening that indicates any type of fungus, and there's no rough ridges on them. I'm going to go ahead and look at your legs now. Look at the skin on your legs. There's no hair on the leg, which is perfectly normal for a female. She shaves and is very hygienically clean. Her skin is still tan with a light pink undertone. It's warm to the touch. There's no edema present. Skin turgor is elastic and firm. Her skin is intact. Same with this leg, it's smooth and dry. I'm going to go ahead and ask you to lay down so I can look at your abdomen. There was no lesions, birthmarks, scars, or tattoos on her arms, legs. There's no macules, lesions, scars, birthmarks, or tattoos on her abdomen either. Her skin is tan with a light pink undertone. It's very warm to the touch. It's dry and smooth. I'm going to ask you to go ahead and flip over so I can look at your back. She has 2 macules on her back that are ½ millimeter in size approximately. Other than that, there's no lesions, birthmarks, tattoos, or scarring or anything like that. Her skin is warm to the touch still. It's dry. There is even distribution of normal body hair. Yeah, it's very good. I can have you sit back up. And that completes our intake assessment on you. I'm going to go ahead now and go into your head and neck assessment, if that's okay. I'm going to start with this, the skull. It's normal cephalic and round in shape. The scalp is adhered to the skull. The scalp is dry. There's no dandruff or any pests present. This is blonde hair. It's color treated. It's very soft. It's fine. It's shiny. It's smooth. And it's very thick. And the hair is adhered to the scalp. There's hair on the face, and her facial features are intact in midline. The only hair on the face is the even distribution of facial hair, and then her eyebrows and eyelashes. I'm now going to go ahead and start looking at the physical parts of her head and neck. Her head is proportionate to her neck and body, and her neck is midline to her shoulders. Her shoulders and everything is bilaterally symmetric. Then I'm going to go ahead and look here, and her trachea and thyroid are midline and bilaterally symmetrical to her neck. I can feel the thyroid on both sides of her trachea, and if you could go ahead and swallow for me. The thyroid does actually, it rises and falls as she swallows, which indicates no tracheal tug, which is great. I'm going to go ahead and now feel your lymph nodes. Try to. Post-auricular, preauricular, tonsillar, submandibular, sublingual, submental, and then the anterior superficial cervical chain. Did any of that feel uncomfortable to you? Any tenderness? There was no tenderness indicated by the patient, and the lymph nodes were not palpable. If you could now, turn your head to the left, turn your head to the right for me, touch your right ear to right shoulder, left ear, left shoulder, put your head back, and put your head forward. Patient has full range of motion in her neck, which is great. I'm going to go ahead now and do your assessment, if that's okay. I'm going to start out by looking at the physical structures in the ears. The ear is C-shaped. It's firmly intact to the side of her head. It's pale in color with a light pink undertone. Let me go ahead and look in the external auditory canal. There's no lesions, there's no excessive drainage that I see. I'm going to go ahead and measure the ear also. It is about 4 millimeters in length, and it's about 10 degrees from being vertical in both ears, and they're bilaterally symmetric. I'm going to go ahead now, and I'm going to perform 2 tests on her hearing. This is going to be the Weber test, and just tell me when you can hear it. No? Okay. There was no lateralization with the Weber test. I'm now going to do the Rhine test, and tell me when you can no longer hear it. It's going to do the air conduction and bone conduction. No. No. I'm going to go ahead and perform this on the other ear as well. Air conduction was 2 times the rate of bone conduction, and that concludes our, oh, no, okay, so I'm going to do the finger rub test, and I'm going to go ahead and ask you to close your eyes and indicate which side you hear my fingers on. Patient was able to localize the rubs of my fingers correctly, and now I'm going to do the whisper word test. So I'm going to ask you to cover your right ear and repeat the words back that you hear.
Orange, yellow. Blue, green.
Patient was able to repeat my words 100%, which means she passed the test. So that concludes our hearing test. I'm going to go ahead now and assess your visual assessment, if that's okay. I'm going to go ahead and start with the very physical features just from looking on the face. And that is her eyebrows, her eyelashes, and her eyelids. They're all midline to her face. They're all bilaterally symmetric. Her eyebrows raise above her eyelids, her upper eyelids. Her upper eyelids are able to close the whole way. Her upper eyelashes run out above her upper eyelids, and her lower lashes run down around her lower eyelids. And now I'm going to assess her pupils. Her pupils appear to be about 2 millimeters in diameter. They're very round, and I'm going to see if they react to light. They react to light in both eyes, and they're bilaterally symmetric. Now I'm going to look at the irises. They are blue in color, they are round in shape, and they are also bilaterally symmetric. Now looking at the sclera, and they are white with slight vascularity in them. And I'm now going to shine the light again in the side of her eyes. This shows that the interior chamber is translucent and shows adequate depth. I'm going to now check out her cornea. Her cornea is translucent and smooth in both eyes. Everything is bilaterally symmetrical, by the way. Her conjunctiva is light pink and it is clear. Then her lacrimal puncta is light pink and clear with no excessive tearing or drainage, which is very good. Earlier in the day, we did 2 tests to test her visual acuity. The Snellen chart was used to determine her visual acuity and distance, and then the Rosenbaum chart was used to test her visual acuity and nearsightedness. And with both tests, she tested 20/20 bilaterally uncorrected, which is very good. I'm now going to check your ocular vision, or your extraocular vision by using the 6 cardinal fields of gaze. Her eyes followed my fingers smoothly, with no problems and no signs of nystagmus. I'm now going to check your peripheral vision. Go ahead and just let me know whenever you see my fingers. Her peripheral vision is greater than 180 degrees. And now I'm going to test your look at my finger. Look at the wall. Her visual accommodation is active. Sorry, I couldn't remember it was called accommodation. So that concludes our vision tests. I'm now going to go ahead and continue with the nose, mouth, and oropharynx. I'm going to start by assessing her nose. Her nose, her philtrum, and her septum all appear to be midline and bilaterally symmetric on her face. If you could tilt your head back for me, please. The septum is midline with no holes. There's some nasal hair in there for filtration. The mucosa is pink, and there's no excessive drainage, which is very good. If you could just close your one nostril for me, please, and blow out the other. And go ahead and do the other one. Nasal patency is present. She's able to breathe out of both nostrils completely fine. So now I'm going to go ahead and assess her lips. Her lips are pink, moist, and smooth. They're vertically and horizontally bilaterally symmetric. Also, the nostrils are both bilaterally symmetric. I'm going to ask you now to open your mouth for me and smile with your teeth. Okay, the teeth are straight and appear to be white. There is no presence of homostasis. They overlap the bottom teeth the correct amount as a normal bite should, and there's good repair work in there. If you could go ahead and and the gums are pink, smooth, with no lesions, and they're moist. Now go ahead and open up for me again, please. Lift your tongue up. Stick your tongue out. Okay, so the floor of the mouth was dark pink in color. It was rough, it was moist, and it was pink with no signs of lesions though. Her tongue had, it was smooth and pink with no lesions. Her hard palate was dome shaped. It was light pink with slight rugae on it. No lesions or anything like that. It was smooth and pink as well. And then her soft palate was smooth and pink, and it was mobile. Her hard palate was not mobile, and her tonsils were 2+, and her uvula rose and fell on phonification, and it was midline to her throat. If you could stick your tongue out for me, please, and move it around a little bit. And she has full range of motion in her tongue. That's going to complete. Go ahead and swallow for me again, please. And her thyroid, yet again, races and falls to show no tracheal tug. That's going to conclude our nose, oropharynx, and mouth exam. And I'm going to go ahead and do your cardiac exam, if that's okay. We already assessed the skin in the intake assessment, and it was normal. I am going to check her fingernails again. I'm going to be checking her capillary refill, and I'm going to be checking her capillary refill on her toes as well. Both were less than 3, which is good. I am now going to go ahead and listen to your heart rate and rhythm. I'm going to start with the diaphragm in my stethoscope, and I'm going to start on the right sternum border, second intercostal space, aortic valve, and then the left sternum border, second intercostal space, or pulmonic valve. Her third intercostal space, left sternal border, Erb's point, left sternal border, fourth intercostal space, tricuspid valve, and then if you could lift your breast for me, please. Fifth intercostal space, left sternal border, mid-clavicular line is her mitral valve, which is also known as her apical pulse. And I'm going to go ahead back in, and I'm going to listen with the bell of my stethoscope to all the same places. Aortic valve, pulmonic valve, Erb's point, tricuspid valve. Please lift your breast for me again. And then her bicuspid valve, her mitral valve, which is also her apical pulse. Her heart rate and rhythm was regular at 80 beats per minute. Her S1 was regularly heard at the apex, and her S2 was heard at the base. No S3 or S4 sounds were heard, and no clicks, murmurs, or gallops were auscultated. I'm now going to go ahead and check your pulses. I'm going to start with your temporal pulse, and then your carotid. I'm going to do your brachial now, your ulnar, and your radial. I'm going to go ahead and do your dorsal pedis. And your posterior posterior tibialis. I'm going to ask you to go ahead and lay on your on your belly for me, please. And I'm still going to be checking her pulses. This is going to be her popliteal pulse. On your back for me, please. I'm gonna check her femoral pulse. All her pulses were 2+ except for her feet, they were 1+. Now if we were in a hospital, I'd raise her bed to 30 to 40 degrees. I'm going to go ahead and check for any jugular vein distension. Turn your head to the right and now to the left for me, please. No JBP was present. I'm going to go ahead now and listen to breweries, if there are any, with the diaphragm. The bell. No breweries were present. Now I'm going to go ahead and check for any thrills. No vibrations were present. I'm going to ask you to sit back up. I'll help you. And then if you could go ahead and mimic this motion. There's no signs of clubbing present. That is all for our cardiovascular assessment. I'm now going to do your respiratory assessment. So you can tell the patient is sitting in an upright, relaxed position. Her chest is in an ovoid shape. She's no obvious signs of chest barreling. She's breathing consistently and effortlessly. She had a respiratory rate of 17, I said earlier. Her lips are pink, they're not blue, there's no signs of cyanosis. I'm going to go ahead and look at her fingernails, and they're pink and adhere to the nail beds. The toenails, I can't tell because there's nail polish, but they are adhered to the nail beds. I'm going to go ahead now, since I already did your skin, I'm going to go ahead and listen to your breath sounds, if that's okay, with the diaphragm of my stethoscope. Go ahead and lift this arm for me. If I could get to your back, please. Okay, all your breath sounds were clear. There were no weasels or crackles auscultated from that. I'm going to go ahead and feel your muscle development. Your muscle development is bilaterally symmetrical and is appropriate for a female of your size. I'm going to go ahead and check your intercostal angle now. Intercostal angle is less than 90 degrees. Your AP to lat is 1 to 2. And I'm going to now check your thoracic expansion. If you could take a deep breath in for me and deep breath out. Your thoracic expansion is bilaterally symmetric. I think that concludes our respiratory assessment. I'm now going to go to your abdominal assessment. If I could get you to lay on your back for me, please, ma'am. If you could lift your shirt up for me. Okay, so the skin is smooth, warm to the touch. It's tan with light pink undertones. There's no lesions or birthmarks or tattoos or any macules or anything like that. If you could hold your breath for me, please. There's a slight aortic pulse present. You can release your breath. There's a slight aortic pulse present. There's no peristalsis at all. I'm going to go ahead now and listen to her bowel sounds with the diaphragm of my stethoscope in all 4 sections. Okay, her bowel sounds were active, normal active, and there was 5 to 35 of them in each of the 4 quadrants per minute. I'm now going to go ahead and lightly palpate you. Did you feel any tenderness with that, man? I'm going to now go ahead and deeply palpate. Any tenderness with that, man? No tenderness was, no tenderness, no masses, no guarding was experienced by the patient upon palpation. I'm now going to palpate your umbilicus. Do you have any tenderness, ma'am? No tenderness, guarding, or nodules or masses were found when palpating the umbilicus either. And I believe that concludes our abdominal assessment. If you could go ahead and sit up, I'll help you. Now I'm going to go on to your musculoskeletal assessment. If you could get up for me, please, and you could walk to the edge of the couch and then back. And stay standing for me, please. The patient's gait was steady. She had an even arm swing. I'm now going to ask her, oh, sorry, I'm not in the shot. I'm now going to ask her to mimic my movements, and we're going to be assessing her range of motion, her active range of motion, and her upper extremities. And then go back with it. Same thing with the other arm. Now if you could flex at the elbows, flex your wrists in circles, do this with your fingers, and then wiggle your fingers. Okay, client has full range of motion and full active range of motion in her upper extremities. Now I'm going to ask you to, she has full range of motion in her neck as well. We discovered that in her head and neck assessment, so we don't have to retest that. Now we're going to do her axial skeletal movement. If you could bend to the side and then twist for me with just moving your hips. There you go. She has full range of movement in her axial skeleton as well. I'm going to ask you to go to the end of the couch now for me, and if you could duck walk. This is going to show us full range of motion and full active range of motion in your lower extremities and your strength of joints. Patient has full range of motion in her full active range of motion in her lower extremities, and it shows strength and stabilization in her joints. If you could go ahead and slowly bend down and touch your toes, I will evaluate the structure of your spine. There's no scoliosis present. There's just enough curvature that is to be expected out of the spine. Now you can slowly come back up. Spine is in great shape. If you could, you can go ahead and take a seat now. I'm now going to assess her passive range of motion in her upper extremities. I'm going to go ahead and take your arm. Like this. I'm going to go ahead and bend your elbow. I'm going to go ahead and move your wrists. I'm going to go ahead and wiggle your fingers. And do the same thing over here. Wiggle your wrists and wiggle your fingers. Patient has full range of passive motion in her upper extremities. I'm going to go ahead and ask you to lay on your back, and I'm going to check your passive range of motion in your lower extremities. Go ahead and take your leg up, out, out, up, out, up. I'm going to do this one, up, straight, out, up and out. I'm going to check your ankles, going to roll her ankles, and I'm going to bend her toes. Patient has full passive range of motion in her lower extremities as well. Now I'm going to go ahead and palpate her bones, muscles, and joints. I'm gonna wash my hands first though because I just touched her feet. And I'm gonna palpate now her bones, muscles, and joints. Was any of that tender for you, ma'am? The patient experienced no tenderness. I palpated no heat, no crepitus, no edema, no masses. Her muscles all seem to appear bilaterally symmetric. In observing her when she first came in, her muscles were bilaterally symmetric and her alignment was even and symmetrical throughout her body. I'm now going to ask you to sit up, ma'am. And I'm going to assess your muscular strength. If you could resist me wherever I push on you. Okay, patient demonstrated 5x5 contralateral strength throughout her whole entire body. If you could grip my fingers, patient was able to show appropriate grip strength as well. Now I'm going to go ahead on to our neurological assessment. I'm going to start out by checking out if cranial nerve 1 is intact. And that I'm going to ask you to close your eyes, and she's going to have to be able to tell the difference between two scents. If you could plug your right nostril and tell me what you smell.
Vanilla.
If you could plug your other nostril and tell me what you smell.
Coffee.
Cranial nerve 1 is intact due to the patient being able to tell the difference between the two scents. Cranial nerve 2 is also intact. We knew that by our tests in the visual charts, the Snellen chart, the Rosenberg chart, and the peripheral vision. So we know cranial nerve 2 is intact. Cranial nerve 3, 4, and 6 is also intact because that was in the vision test as well. Now we're going to go ahead on to cranial nerve 5. I'm going to ask you to close your eyes. And I'm going to ask you to point to wherever you feel this touch your face. And now I'm going to ask you to clench your jaw. And I'm going to ask you to clench your jaw and not let me open it. Cranial nerve 5 is intact due to her being able to locate where I touched her face and her showing me strength in her jaw. Now I'm going to assess cranial nerve 7. And so if you could smile for me, smile without teeth. Frown for me, lift your eyebrows up for me, and puff your cheeks out for me. Cranial nerve 7 is intact due to being able to mimic the facial expressions I asked her to. I'm now going to, cranial nerve 8 is also intact, we knew, due to the hearing tests and ear tests we did, the Weber test, the Rhine test, the finger rub test, and the word test. So cranial nerve 8 is intact as well. Now we're going to check cranial nerve 9 and 10. So if you could swallow for me, and if you could stick your tongue out and say ah. Cranial nerve 9 and 10 is intact due to being able to swallow and stick her tongue out. Now cranial nerve 11 was also, we already checked whenever we did the musculoskeletal assessment, her being able to resist my shoulders, me pushing on her shoulders and on her head. Now I'm going to assess cranial nerve 12 and see if it is intact. So I'm going to ask you to stick your tongue out for me, move it around a little bit, and then push your tongue against your cheek against my hand. Cranial nerve 12 is intact as well. I'm now going to go ahead and ask the client to stand up with her eyes closed and put her arms out in front of her like this to check her balance. Patient is able to stand up like this perfectly fine. She didn't sway at all, so her balance is intact. I'm now going to go ahead and check her reflexes. I'm going to go ahead and do her brachial first. And now her patellar. Those were all intact at 212. I'm now going to check her sensory. We already have checked a little bit of her sensory with her ear test, her nose test, her trigenital nerve tests, and her eye test, her visual test. But now we're going to go ahead and do one that she has to be able to close her eyes and be able to tell me where I poked her and if I poked her with the sharp side of this object or the dull side. Dull. Sharp. Dull. Sharp. Patient was able to differentiate between dull and sharp and was able to locate where I touched her, so her sensories are all intact. I'm now, whenever she first walked in, we checked her gross motor function and her lower extremities, and it was intact. Now I'm going to go ahead and check her fine motor function and her lower extremities. So I'm going to go ahead and ask you to put your heel on your shin and drag it up, and the same with the other leg. Her fine motor functions are intact for her lower extremities. I'm now going to check her gross motor function in her upper extremities, and I'm going to ask you to do this on your lap and this, and now do it a little bit faster. Her gross motor functions are intact in her upper extremities. Now I'm going to ask you, now I'm going to do her fine motor functions on her upper extremities. I'm going to ask you to touch your fingers. I'll go a little bit faster. Her fine motor functions are intact in her upper extremities as well. All 12 cranial nerves were intact, and including the 4 we just checked, her reflexes, her balance, her sensory, and her muscle movement. They were all intact, so that concludes our neurological assessment, and the neurological assessment concludes our whole head-to-toe assessment. Do you have any questions for me? Thank you. Have a good day.
Thank you.
How bad did I miss?